Okay, great. So I guess before we get started, just wanted to say that if anyone has any questions throughout the presentation, feel free to ask them as they come up in the Zoom chat or the Whova chat. We'll sort of check that and we'll try and get to them if we see them during the presentation. If not, we'll definitely try and answer all the questions at the end.
Great. So just a little bit of an overview. In today's workshop, we'll cover the Student Mental Health Project. And so we'll start by providing a little bit of background on the project as a whole. Then we'll dive into some of the substance use data that's generated from our weekly survey. We'll also touch on the co-development process for our mental health and substance use app Finder. And we'll focus on kind of some of the substance use specific content that we have in there. And then we'll finish with some discussions on next steps in terms of adapting our app for different populations that we're now with. So in terms of the Student Mental Health Project, it is a 4-year multi-site study for Canadian university students, and it's in collaboration with the WHO International College Student Survey based at Harvard Medical School. And it's funded by Health Canada. So you'll see we're actually active in terms of the kind of two main components that we have is a weekly survey that seeks to identify the current mental health and substance use concerns of Canadian university students. And then the second component is a mental health and substance use app called Minder. And our kind of weekly survey is actually active at UBC, SFU, McMaster, and Toronto. So we'll go and talk a little bit specifically about the weekly survey first. So the weekly survey itself has currently a total of 41,060 participants across all 4 of the sites. You'll see here that they have kind of varying degrees of responses because we started off at UBC first and then SFU, McMaster, and U of T. So they've been going for varying lengths of time. It's a weekly random stratified sample of 350 students that we follow up through an email partnered with the organization and the administration at that university. So 350 students get emailed every week. And then we also do a personalized follow-up, either through a personalized email from the study PI or a phone call to a random subsample of 70 non-responders to decrease that non-responder bias. And for UBC, SFU, and McMaster, it's actually been going on for so long that we've depleted some of our samples and we actually transitioned to a biweekly sample this past October. So what can we actually see from the data that we've gotten from here? We performed a Latin class analysis here to identify subgroups of respondents with patterns of mental health and substance use. And so we chose a 4-group Latin class analysis here. And so you can see here on the left side, this is the probability of reporting a mental health or substance use concern. Mental health here we've designated as anxiety or depressive symptoms, and then substance use covers cannabis, alcohol, opioids, and stimulants. And from these 4 classes, we can see that kind of, as you might think, we have kind of people who are low on mental health and low on substance use, low on mental health and high on substance use, high on mental health and high on substance use, and high on mental health and low on substance use. With the majority, 45.72% is that blue curve that you see there. That's high on probability of having anxiety or depressive symptoms, but low on actual substance use. The second group then we see there is actually those who are in the green curve, who are low on mental health symptoms and low on substance use. So we can say that the majority of students actually do fall within kind of lower high mental health, but low substance use. I'll hand it over to Priscilla to tell you a little bit more about substance use.
Hi, everyone. And now I want to present a little bit of the results of the survey regarding substance use at UBC. So these are based on UBC students' response regarding substance use in their lifetime. So drinking alcohol was reported by 74% of students, while only 18% reported binge drinking at least once a month, and is the substance that is most commonly used among students. And regarding cannabis, 37% were cannabis users, but just over half of them used less than once a month, and 20% used 3 or more days a week. Now, looking into more high, what we call high substance, there are such as stimulants and opioids, and we call them high risk substance because they substance are at higher risk of both addiction and overdose. And we can notice that the prevalence of use of these high risk substances are considerably lower, meaning that considerably fewer students reported using high risk substance compared to alcohol and cannabis. So 4% have used prescription opioids such as codeine and oxycodone for recreational reasons, while only 1% have reported street opioid use such as heroin and fentanyl. And for you guys to have an idea, this 1% represents around 120 students. And when we look at the prescription opioids that were prescribed by a physician or a mental health practitioner, and they were used as prescribed, this account for 16% of students. And then for recreational use of prescription opioids, such as Ritalin or other amphetamines, was reported by around 4% of students, and street stimulants like cocaine by around 5%. Can you move to the next slide, please? Now we will take a closer look at high-risk substance use. So, like I said, these include street opioids and stimulants, both street and prescription opioids, and street and prescription stimulants. So from the sample that we have, this is only including UBC students, so the other sites are not included in the analysis here. And our analysis showed that 8.9% or 1,040 students reported lifetime use of opioids and or stimulants for recreational reason. And among them, 62% reported only ever using one substance, mostly common street stimulants and least common street opioids, as you can see in the upper right corner. And 32% of these students reported polysubstance use. So they said that they used more than one of these high-risk substances. And in the lower right corner, you can see the profile of this substance use. So half of the polysubstance users reported using at least prescription opioids and street opioids. 28% reported using street opioids and street stimulants, and 25% reported prescription opioids and prescription stimulants. And as you can see, this doesn't sum up to 100. So that means that each of these circles, it means that the students reporting use at least those two substances, but they could also be using three or other substances besides those. And now I will hand over to Tiana, or to Angel again.
So we'll transition a little bit now that we have a kind of a better understanding of what the substance use landscape looks like for university students. We'll transition a little bit to talk about the app that we've developed, Minder. So like I mentioned, Minder is a app for managing mental health, for kind of improving mental health and managing substance use for university students. And the approach that we've taken in Minder is that it's designed for a general population, so not a clinical or disorder level population. And because of that, we've taken a more holistic approach. As you might know, there's such a co-occurrence between mental health and substance use. And a lot of the issues that come up are actually quite interconnected. So through this app and the kind of interventions that we developed, drawing from an evidence base of CBT, DBT, MCT, mindfulness, motivational interviewing, psychoeducation, we've taken a very holistic and kind of both mental health and substance use approach to kind of address these issues. So I'll hand it over to Tiana to talk a little bit about our co-development.
So, Minder was co-developed with the target audience of students in mind, involving them as lab members like me, as well as in our student advisory committee, virtual boot camp, focus groups, and pilot trial. Together, these groups helped us create, design, and review content, as well as trial the feasibility of the app. And currently, we're wrapping up a randomized control trial to test the effectiveness of Minder. The four main components of Minder comprise of the main intervention with the chatbot videos and infographic summaries of the content, a peer coaching section by trained student volunteers, a triage survey for on and off campus resources, and a directory for clubs. Students can also customize their profile with a custom avatar and username, receive push notifications, and unlock features as they go through the chat activities, all of which incentivize app usage. Minder also includes emergency resources provided through an SOS button on the homepage and a protocol for expedited counseling services. And activities in the main intervention component cover topics like managing emotions, learning about alcohol, cannabis, opioids, and stimulants, relationships, and general well-being. The content, language, and formatting of these activities have been considered with the UBC University students in mind, with multiple written and all of them reviewed by UBC student team members. And then I'll hand it back to Angel to talk about the substance use specific components.
So you're handing to me.
I think it might be Melissa, yeah.
Oh, sorry, Melissa.
All good. Yeah, so Tiana gave a brief overview about the content, but because of the focus of this workshop and this conference, we wanted to talk a little bit more about the substance use content specifically. So I've broken this down, I guess, in the top, you can see by sort of the general type of content it is. So we have content on motivational interviewing for each of the four main substances which we're targeting, which are alcohol use, cannabis use, opioid use, stimulant use. So the motivational interviewing comprises things like, understanding the situation, thoughts and feelings you have around when you're using these substances, going through some things you maybe like about it, things you don't like about it, things that might be better or worse if you were to reduce your use, which we include some examples, which we know are really common to students. So things like, maybe you wouldn't be feeling hungover the next morning, maybe you wouldn't be spending so much money, maybe you'd have more time to focus on schoolwork, things like that. And then we move into an assessment of readiness to change. So, do they think that they would be able to do this? How confident are they feeling that they would be able to cut back if they wanted to? And then finally moving into goal setting, if this is something they're interested in. So trying to set a goal for the week of how they could cut back using the technique of SMART goals. So trying to set goals that are realistic for their substance use. We also have content on psychoeducation for all of the four substances, which varies depending on the type of substance. So for example, for alcohol and cannabis, we have normative feedback for the students that is actually based on the data we have from our survey. So as you saw before, we have quite detailed data on the amount of alcohol use amongst students in the UBC population, as well as to some degree, the amount of cannabis use. So we're able to provide them really specific feedback based on their choice or their gender. And then we're also able to provide them some general information on the substances. So things like risks, different types, as well as some sort of strategies they could use to use the substances more safely. For example, with alcohol, eating before you're drinking, having water, trying to set limits in line with the guidelines, things like that. We also have, for alcohol specifically, a drink tracking tool, which is delivered through the chatbot as well, but it sort of allows them to set a goal prior to going to drinking, and then allows them to track through the chat every time they have a drink, and also send them reminders to sort of check in, as well as do some of those easier strategies such as eating and having water while you're drinking. And then finally, we have a sort of video series on refusal skills. So we've called this Setting Substance Use Boundaries, in which we go through some sort of basics on communication styles and body language, which isn't necessarily specific to substance use and peer pressure, but can be sort of used to any situation where you're feeling pressured to do something or where you want to communicate boundaries, and then going specifically into some refusal skills they can use for trying to turn down substances if that's what their goal is. And then this is just a quick look at what our substance use island has. All of the content in our app is sorted through on these islands. So as you maybe saw on the slide Tiana showed, there is a substance use specific island in which we have all of the content mapped up like this. So they can just choose whatever activities they want. And as you'll see, there's also little summaries which become unlocked if they complete the activity. And this is just a quick example of what one of our chats looks like around the normative feedback. So we have an automated chatbot that is entirely pre-programmed. So it's not an AI chat. It's just something that you'll either have the option to select responses like multiple choice, or also in certain cases to type in free text responses, but knowing that the chat itself isn't aware of what you're saying. And it's just sort of going based on the understanding that you are sort of checking your responses and understanding what the chat is asking of you. So for example, here, we're asking them how many drinks they have on a typical day when they're drinking, and then how many student or how much they think the typical female UBC student drinks that. So in the beginning, we asked them whether they prefer to have feedback based on female students at UBC, male students, or all students altogether, just because that's sort of how our data is limited. And then in doing so, we can provide them with really specific feedback. So if they had said 4 drinks, then we can show them on this graph that in comparison to other students, they're drinking more than 86% of other female students on a typical occasion, because the data have sort of found the more specific you can be in this feedback, the more helpful it is. And then this is just an example of one of the summaries we have. So the goal of these summaries is just to provide an overview of the content so that should they want to refer to anything that they had learned throughout the chat, they don't necessarily have to go back through the entire thing to get that information. So here we have some of the main content that's covered through our psychoeducational script on alcohol. So things like the lowest guidelines, which were based on the previous lowest guidelines, which was when the content was developed, but we may have to change now. Some tips for safer drinking. Again, these are really straightforward things, but can sort of serve as a helpful reminder for students. Some information on what a standard drink is and also what binge drinking is. So then moving into the next steps. So like Tiana mentioned, we are sort of wrapping up our randomized control trial of the app. We have nearly 1,400 participants in that trial. So we're looking to see whether in a general population of students that this is effective as an intervention for both mental health and substance use. But now we are moving into sort of other projects trying to actually adapt the Minder app, which has been quite specifically designed for Canadian university students and specifically UBC students, trying to adapt this for some different populations. So the key main ones we're working on now are high school age students, subpopulations of university students, so within our UBC sample, and then also other Canadian universities. So just a couple of things that we have sort of thought of as we've considered how we can go about adapting this. And I guess something that's been really important to us throughout all these conversations is that we definitely want to incorporate the co-development process even in these adaptations, because although the current Minder app was co-developed with quite a few university students, we feel like that process was incredibly valuable in getting to a product and a tool that really meets, hopefully, the needs of the students and incorporates a lot of feedback we've received there. So making sure that when adapting, we're sort of following that same process and not leaving out the really important opinions of end users. So some things we have been considering in this approach is who our target audience is. So for the high school students, this is obviously an age group that is similar to university students, but can be a really different period of life and also encompasses a much broader sample of people in that it's everybody in the province of BC, and not all of those will then go on to university, for example, which is our current population. So thinking about who that audience is, thinking about as well sort of the length of content we have. So something we've thought about a lot for the high school students is given their age and the way content is even delivered now over social media, considering the length of content and whether even the existing things we have for university students might actually be too long. So we might shorten that to sort of meet better the needs of that audience. Also considering things like language. So, the language we've used for university students may or may not be applicable to high school students who may have a different understanding of these types of concepts and may use different language even in their everyday lives in the chat. The delivery of content. So something we've been thinking about as well, again, with sort of how content is delivered these days, for example, through social media, thinking about whether we should incorporate more things like videos or other ways to make content more engaging for this type of population. The topics covered. So obviously, some of the things that we've covered in the university student app, we think are quite applicable to high school. For example, things like sadness, anxiety, wellness, well-being, those types of things. But there's also a lot of things that high school students deal with that maybe aren't specific to university. For example, topics like bullying, sort of relationships within their family, some different sort of substance use concerns that come up. So all of those are things we'll be assessing and thinking about how we can both adapt existing content we have, but also develop some new content that is better meeting the needs of what this population is dealing with. And finally, also the resources available. So a really important part of our current app is our services section, which matches students with resources based on their needs and preferences. However, this might look a lot different in high school age students, just because the resources available are very different than, for example, the university counseling services that are available. So considering how this looks in a population and also across the whole province as opposed to a specific university. So just to give a bit of an overview then in what we have decided on for our process for adapting to high school students is that we really want to replicate again a lot of this co-development process and making sure we're getting feedback in a lot of different ways from high school students and not just sort of jumping to conclusions as to what may or may not be best for this population. So in doing that, we have already had several student placements. So have students come in for about a week at a time and be able to, I guess, learn from us as well as provide us some feedback on the app and what they think might be most useful for their age group. We're also developing a student advisory committee similar to the one we had for university students, where we're asking students from districts across the province to join this advisory committee and sort of guide our research process. We're also currently in the process of a UI UX feedback survey, which we've sent out already to several schools in the Vancouver School District to get some feedback on the existing app, the way it looks, the way they sort of move through it and how we're delivering content so that we can get a better idea of how the actual adaptations should look of what we currently have. We're also have done already several student engagement sessions in different schools across the province, trying to hear sort of firsthand from students what the main mental health and substance use concerns are from them. And we've already, from that heard a lot of things that are actually quite different from our experiences with university students. For example, even in terms of substance use, it seems like maybe the 4 main substances that we covered previously, so alcohol, cannabis, opiate, and stimulants, there are actually other ones that may be more relevant in high schools. For example, things like vaping, nicotine, even caffeine are really common amongst this age group. So we've sort of reassessed how we're going to do all of our substance use content for that group. Consultations with professionals and stakeholders. So I think this is something really important for us as well, to understand how we can sort of develop this app and place it within the existing systems of mental health and substance use care for youth. So making sure we're understanding both, from a school level as well as more of a health systems level, how this can sort of fit into that. And finally, we plan to do some user testing once the app is sort of adapted. We're not entirely sure what that'll look like, probably not a full randomized control trial, as that's what we're doing now, but some type of user testing so we can get feedback on the actual look and feel of the product we develop. And then just to speak briefly about some of the adaptations for subpopulations we're looking at. So I guess this is a focus of ours now, given that we have this general minder app we've developed for university students. Again, it's meant to be for a general population, not necessarily with not a clinical population, but we want to make sure that we are sort of looking at some of the subpopulations that are often particularly impacted by things like mental health and substance use, and making sure that we're having specific consultations with students and experts in these groups to make sure that the app is accessible and makes sense for them. So in doing that, these are sort of the main groups we've been trying to reach out to and engage with. So international students, again, at UBC, there is a large proportion of students that are international. So consulting with both students themselves, as well as some advisors as to what sort of their mental health and substance use needs are. Racialized students at the university, which again could include international students, but also more local students, Indigenous students specifically, LGBTQ2S+ students. So again, trying to consult with students themselves, as well as sort of experts and advisors in that area, students with disabilities. So to make sure that the app is both accessible, as well as trying to understand what their specific mental health and substance use needs might be. And finally, students who use substances. And I guess this group is a bit different from some of the other groups in that we actually did try and specifically involve students who use substances in the previous adaptations, the co-development process. However, this is something we think is really important and we want to try and understand better, which is why we have added this to sort of our second round of engagement, trying to work with some student groups who are actually at the university and supporting others to understand how we can improve what we currently have. So that sort of brings us to the end of our presentation. Just have a few acknowledgements here of the many, many people who have contributed to this work, as well as many that aren't even on this presentation. And with that, we'd like to open it up and see if there are any questions.